Dr. William Schaffner, a professor of preventive medicine at Vanderbilt University in Nashville, is here. Doctor, thank you so much for joining us. I want you to break this down for us. How concerned should Americans be? How serious is this?
Well, I know that Americans are concerned. They're watching this very carefully, Rena, because, after all, pregnancy, infection with the Zika virus can have very serious consequences. I was asked about this just this morning, about how concerned someone should be. At the moment, let's be clear, there's been no mosquito-borne transmission of this virus in the United States. The ladies who are all infected acquired their infection when they went abroad, or occasionally when a gent who was abroad came here and had intimate relationships with them. But there's been no mosquito-borne transmission yet in the United States.
Are you concerned, doctor, as the summer season ticks up and it gets hotter and the mosquitoes are more prevalent, that we could see cases where women are bitten by mosquitoes here in the U.S.?
Well, women and men, I think it is possible that cases will come into the United States, will be bitten by our domestic mosquitoes, and we will have some limited transmission in the United States. But I think our public health resources are such that they will jump on that and curtail its spread. It will not become widespread in the United States, but I think we'll have some introductions with a little spread.
And remind us again, Doc, what are the symptoms?
So symptoms of acute Zika are fever, feeling badly, a rash, and red eyes that can last for several days for about a week. That's simple Zika. It goes away, and once it's gone, you don't have to worry about it unless you were pregnant. And then, of course, the virus can cross the placenta and get into the baby. And if you were a man, perhaps the virus can hide out in your reproductive system and be positive in your semen for some months thereafter.
In some parts of Central America, they actually told women, hold off for a year, don't get pregnant, the risk is too great for some sort of side effects from Zika. Do you think that women here in the U.S. should be concerned? Will we ever get that type of a request from health officials to tell women not to get pregnant?
I would be very surprised if our health officials ever made that kind of a recommendation. First of all, I think the Zika involvement in the United States is going to be much too modest for that. But there will be a lot of consultation with individual obstetricians. Now, in the territory of Puerto Rico, where they have ongoing Zika transmission, that's another matter. And I would imagine that there are a lot of couples who are counseling with their obstetricians about whether they ought to wait to initiate their pregnancy for a period of time.
If you've been to Puerto Rico, Doc, should you consult with your doctor if you're thinking of getting pregnant?
Well, if you've been to Puerto Rico, come back, and, for example, a month has passed, then you need not worry if you're a woman. A gentleman might be concerned that they have Zika in their semen, however, and that's still not easy to detect.
Still so many things to worry about. And I got to tell you, I'm still also worried about ticks. It's another big thing that moms worry about this time of year too, Doc, in addition to mosquitoes. Dr. William Schaffner at Vanderbilt University. Doc, thank you so much.
Thank you.